And there are major changes coming to the Department of Health and Human Services as thousands of jobs are cut. HHS Secretary Robert F. Kennedy Jr. announced massive cuts to several agencies as part of his mission to make America healthy again. Scripps News Group's Dan Grossman is with us now. Dan, you talked with some experts about the impact that this could have. What'd you find?
Yeah, Alex, a lot of the experts that we spoke with are concerned with the overhaul happening at the Department of Health and Human Services with some 10,000 workers laid off. They say they are particularly concerned about what this could mean for life-saving vaccines.
A major restructuring of the Department of Health and Human Services is taking place under HHS Secretary Robert F. Kennedy Jr.
HHS is a sprawling bureaucracy. We're going to do more with less.
Kennedy announcing on Thursday major cuts to health agencies, including the FDA, CDC, and NIH. Cuts, he says, will focus on paring back excess administrators. But health experts are sounding the alarm.
It's going to be hard and difficult for the agencies to provide the same level of service with much fewer employees.
Josh Michaud is with KFF, a nonprofit health policy research organization. He notes there are particular worries about the impact cuts could have on vaccines.
Each of the agencies which have been listed as being the target for cuts has some role to play in vaccines.
The cuts are the latest HHS overhaul. On Tuesday, federal health officials announced billions of dollars in COVID funding cuts from local health departments. HHS officials point out the pandemic is over.
To just broadly cut COVID-19 projects because there's a perception that COVID-19 research isn't needed because there's no longer a pandemic is not only short-sighted, but it's actually very dangerous.
The funding cuts and workforce cuts have virologist Andrew Pekosh concerned about the future of Americans' health.
In a worst-case scenario, I think people will end up being more susceptible to infectious diseases because the vaccines aren't there, nor is the messaging to get vaccinated going to be there and put forward in an efficient manner.
We also learned this week through a leaked document that the U.S. plans to end over 5,000 awards from USAID, some of which help provide vaccines for other countries. The virologist you heard from in that story said that could mean more infections and deaths abroad, Alex, and potentially more viruses then coming back into the U.S. through international travel.
And Dan, you mentioned that Secretary Kennedy says he's focused on getting rid of administrators and not scientists. So what could that mean across the board?
Kennedy said he wants to increase the number of scientists and frontline workers. So until we actually know what specific positions are being cut, the experts we spoke with said it might be hard to say the exact impact and how quickly it might be felt, Alex.
Dan Grossman, thanks so much.